What's up, guys? John here, Titan Talk Tuesday. It's been a good Tuesday so far. Let me get this Instagram on lock real quick, guys. Sorry, it's off. 1 second. We're going to get going on the show. I want to make sure everybody's all tuned in. Going to have a great show for you guys. Titan Talk Tuesdays officially in effect. So we're going to talk about all kinds of different things. EDCs is one of them. And you're not thinking about electronical Daisy Carnival. This is not a music festival. We're talking about endocrine disrupting chemicals. That's right. Things that can mess with your body. We'll talk about some of those things and what it can affect in your body and all the different things and how we can help out, right? Or what you guys can look for in some of these things to make sure you guys are protected right now. Blood testing. Why is it important? We'll go over a couple different things. Now, blood testing is important for a lot of different things. We'll mention some of the different things that I'm going to talk about today and how it can help. How you guys all doing? Thank you guys for all tuning in. I appreciate it. Another Titan Talk, full in effect. We got a lot of good information coming. If you guys can see right here, if you guys can't see in that picture, I've got an IV and it's probably translucent on Facebook, but Instagram, you can see this bag. It's connected to my arm here. I'm ready to go, so I'm getting all my nutrients, micronutrients, vitamins, amino acids, essential minerals, and more super antioxidants in that bag. One bag, and it's going to deliver all these great things to me right into the bloodstream, right? Not even intermuscular, not subcutaneous, but right into the bloodstream, right into the vein. So that's a good thing. As long as the professional's doing it and you're getting monitored and everything's right there, okay? All right, so we'll talk about blood testing. Therapy of the week, IGF-1 LR3. Man, we've had IGF-1 LR3 for a long, long time. I don't post about it too much, but we did post about it yesterday. 52 comments right off the bat. Couldn't believe it. Just on Instagram alone. So it's a very, very popular therapy out there, and we're going to talk about why it's a popular therapy and how it can help you guys out there, right? And it's attached to growth hormone, human growth hormone. That's a big popular word out there right now. I know some over-the-counter supplements claiming they have HGH-type supplementation. So we'll talk about some of that. I'll get your opinion. We'll go in depth about that, okay? Where it comes from, how it helps your body, all the whole nine. We'll go in depth. All right, that's therapy of the week. So you guys can get that therapy, IGF-1 LR3, and what you guys are thinking, what's LR3? I know what IGF-1 is, but LR3 is the long extended version of it. We'll talk about that too. All right, states are opening back up. So depending on what state you're in, this Thursday I just read, that Florida is opening up our pools on Thursday, and beaches will be open here very shortly on Monday. Thank God. And I know a lot of you guys from around the country usually look at Florida like you Florida morons down there, right? Or what's going on down in Florida, all the crazy stories coming in Florida. Even with the COVID thing, we were in the news a lot. We'll talk about that too, right? Being humble no matter what your place is in life right now or in future or in the past. No matter what you have, and you should always respect other people and their things. You have no idea what they went through. So we'll talk about that too. Coronavirus stimulus package giveaway. That officially went up today on social medias. If you guys have not seen that contest, it's week 2 of the Titan Corona Stimulus Package giveaway. And we're offering up some things on that. We'll go over that too as well. And we'll go over the poll question, all that good stuff. So let's get into it. EDC. And we're not going to a music festival. We're talking about endocrine disturbing chemicals. And these are all over the place. Have you guys ever read about EDCs? Endocrine disturbing chemicals. Disrupting. Disturbing, disrupting.
Not the same thing.
It's the exact same thing. So, I'm sorry, but it's good correction. Disrupting. Endocrine disrupting chemicals are disturbing. They're disturbing things. Or they're disrupting things, however you want to look at it. But they are messing with things in your body, and let's talk about what. So endocrine has to deal with hormones. So hormones are getting disrupted or disturbed by what? By these different chemicals. Now you're like, where are these different chemicals at? I want to get away from these different chemicals. Are they in house cleaners? Are they in the environment? Are they on things that you're putting on your body? The answer is yes to all these questions. Okay? So in some of the cleaners in your house, if they're not organic or not biodegradable as far as that goes, or not good for this, they could be disrupting your endocrine system. That means disturbing hormones. And it also happens with the air, our environment. We have a lot of toxins in the environment, a lot of things that we're breathing in every day. These are disturbing or disrupting our hormones. along with what else, guys? With the things that we're putting on our body, antiperspirants, deodorants, and we need deodorant, right? We need these certain things, but there's a lot of different things that you're putting on yourself. Your body is porous. That means it has little pores, and it's absorbing these things through it. So these are messing with our hormones. Now, we've seen this, especially in the last 10 years, right? I've been in the business. We've seen major deficiencies in hormones or just straight out deficiencies or low ranges. And this has to deal with not people that are just 40 and over and they're getting old and we know they're deficient in their hormones and the hormones are going to start declining through age, right? But we're seeing this in young people. We're seeing this in very young people. And we only deal with 21 to 60 years old. So we haven't even tested everybody underneath that. We have no idea. But 18-year-olds could be in the same boat. If we're doing somebody at 21 years old and their levels are deficient, we're talking about free and total testosterone levels. Let's talk about puberty, right? And when some males get they get gynecomastia like from puberty, basically, and their hormones are getting jacked up. Pre-puberic gynecomastia. And this happens when their hormones get, something happens in their body where their hormones are getting jacked up. It's either genetic-wise or it's either some hormone is getting disrupted or getting told to do something that it shouldn't. And at that point, that's when these guys, they could be 12, 13, 14, 15 years old, get gynecomastia, right, as adolescents. And this is from hormones. This is from hormone imbalance. This is from estrogen levels rising, right? We don't know why. And this is part of the reason. This is a major thing out there. This is messing with males and females. Let's talk about 21-year-old and up. When you're 21 years old, you're not supposed to be deficient for testosterone levels as a male. It should be almost at its highest peak. You should be feeling your best. These are the golden years. These are the best years. These are the years that you should be able to do the best you can body-wise, physically, mentally, right? These are when your body's at its prime. So, with these levels being off, you're not going to feel like you're prime. You're going to feel like these levels, or you're going to think this is normal. This is not normal. You shouldn't feel like this. So 21-year-olds especially, or 20, and I'm not advocating for 21-year-old to take testosterone. I'm saying get your levels checked to see where things are at. There's other medications out there that could possibly help 21-year-old or a young person out. When we start getting to 30 years old now 30, you're right in the middle there. So it shouldn't be a problem either. We start to usually see a decline in some of these hormone levels, males and females, but now we're starting to see it a lot worse, where they're deficient. They're not just on the lower end, they're starting to come back deficient, and this shouldn't be like this. Now, a 60-year-old, 70-year-old, 80-year-old, we could definitely see that happening because their lifespan and everything coming down, the deficient levels, declining levels, we see that's happening. But now, I'm telling you, thousands of blood tests come across the boxes a day, right? Through Titan Medical Center. And our doctors and medical providers have seen these. I've seen these. I've been right along with them. I'm in the office every day, especially the first couple of years. I got to look at every blood test with every medical practitioner there was to learn everything there was about it and understand. And what we've seen, this influx of males and females on both decline, deficient, right? It was not cool, and like this, it correlated with what their new patient paperwork said. With, listen, I'm tired. It could be for males, like erections aren't that good anymore. Skin elasticity, hair brittle. For females, a lot of different things like bloating, irritability, and this could happen for males and females. Rapid weight gain and didn't know what from what. Didn't change in diet, no change in exercise. So these are definitely some of the things out there. So. The blood testing is key to really know what's going on inside. And that's where we get into blood testing and why it's so important. And especially with these endocrine disrupting chemicals out there or disturbing chemicals. So at this point, they're messing with our body one way or another. Now, the only true way to see is to blood test, to fix it, and at that point, move on and hopefully, get away from some of these different things that we could possibly get away from that we may not have known about or was bad for us. And really, when you start looking into it, I want you to Google endocrine disrupting chemicals. And at that point, check it out and see some of the different things that you might be using day to day or could prevent using in your daily life and maybe take away from some of these things. Now, we're not going to get away from everything. Now, with the mask thing going on, that might help us with pollution factor. That might be one benefit to the mask. And that's why Asia, I think, was really wearing it in the beginning. And I know, obviously, because of SARS and all that broke out over there, and now they started wearing it more than ever. And with coronavirus, it looks like we're going to mandatory be doing it. I seen in Houston, it's mandatory, right? If you're 10 years or older to wear a face mask in Houston, Texas. And if you get caught without it, it's a $1,000 fine. Holy cow, guys. I mean, in Florida, it's not mandatory yet. I can see it coming very, very shortly, though. Paul, 60 years on the road, semi-driver, blood work here is the best. Yes, blood work definitely the best. Thank you, Paul. Guys, if you need to get your blood work done, right, we can help you out nationwide, wherever you're at. We can send you into a lab near you in your zip code to get all these hormone tests done, your liver, your kidney, your prostate, hemoglobin A1C, which is sugar levels, a lot of different tests, amino acid blood testing, STD testing, all these different things through blood testing now. So it's really simple and really easy. Call and text 727-389-3220. Now, this is even a better time for you guys to call or text. The reason why is this. Through this corona pandemic, we've actually put a lot of specials in place. One was a blood work special. This was for new patients, right? Or old patients that want to take advantage of it. They need it for 6-month blood testing or just want to see what was going on. So even if you're not a patient, you can call and text and take advantage of this special. $130 for a male panel for you guys. Female panel is $200. This is a big savings. $70 on the guys testing, $100 savings on the girls testing. I'm telling you guys, take advantage of it now. And that covers all your hormones like free and total testosterone, estradiol if you're a male and female, progesterone levels, IGF-1 levels, which we'll talk about here shortly. IGF-1 LR3, which is therapy of the week. So we're testing IGF-1 levels in this panel too. And what does that stand for? Insulin-like growth factor 1. And this is what is produced in the liver after you take, or your growth hormone goes down into the liver, it produces IGF-1, 2, and 3. And IGF-1 is where you get all the benefits. We'll talk about that therapy real quick because we're leading right up into that. But when you're doing blood testing, guys, it's really key to really keep a hold of these tests, know your results, know where you're at, know where you're going, right? You know where you've been and you know where you want to go. So if they're low or deficient, you want to get them to optimal ranges. And being monitored by Titan Medical Center, we can help you out with all those medications that you might need. So if you have a deficiency or a problem, we can help you out, right? So it's very simple, and you guys can do it through telemedicine. You don't have to fly here. You guys can actually get on your telephone with your cell phone, your computer, your tablet, laptop, whatever it is. You guys can do the visit with the medical provider face to face like that. It's fully recorded. We see what's going on. We go over all your questions, all your concerns, family history, medical history, goals, symptoms, all that good stuff. We want to make sure the service is personalized for you guys and the regimen is personalized as well. So that's really what it is. So let's get into the therapy of the week. We talked about IGF-1, right? Insulin-like growth factor 1, right? So what did this do? So insulin growth factor 1, right? So LR3 means it's a long-running compound, right? It's going to run in the body longer. Straight IGF-1, if you were to get straight IGF-1, it's very quick in and out of the system. Very effective, very expensive, okay? So ours is a lot less expensive than the name brand out there. It is compounded by our compounding pharmacy. It comes from a U.S. licensed pharmacy. That means it's tested, right? So we know where it's coming from. We know what the concentration and potency of it. To get IGF-1, do you have to have blood work done first if you're already a patient but haven't done blood work? So yes, you do need blood work with IGF-1 therapy, and we need to test IGF-1 levels and some different things in the body. There is a test for that. There's a discount on that test. I believe it's $100 for all the testing, and you do get a lot of testing involved with that too. So it's not just an IGF-1 panel. It's got more than IGF-1 labs in there, okay? So yes, you will need that even if you are a patient. You do need to do blood work for IGF-1 LR3 for us, okay? But what can this help you guys out with? This can help out with a number of different things. So we know IGF-1 levels can help benefit sleep patterns, libido, skin, hair, nails. It can help with recovery, whether you're in the gym, healing patterns, so from surgeries or just healing in general, scars, scrapes. So it can definitely help out with that. The collagen base in the skin. So it's good for skin elasticity too as well. That's another benefit. It also can help with, as far as lean body mass, right? So increasing lean body mass, helping, not wasting away muscle. And that does happen over time, right? So at that point, IGF-1 LR3 is a great therapy for patients to utilize if they can. Now, there are some things that could go against IGF-1 LR3, and this is why a medical practitioner should be going over things with you and making sure it's the right therapy for you. So all these therapies are good, and a lot of them don't have a lot of negative side effects. The one thing with IGF-1 LR3 is you don't want to be a former cancer patient per se, maybe have a lot of cancer in the family history. This could stimulate cancer growth. That's one thing about IGF-1. It stimulates cellular growth on the cellular level, and this could also go for that. And I will always tell you guys the truth. Most of patients, very good, very safe to use. Some patients might not be. And there's different things for different people. So if you guys can't get this therapy, don't worry. We have other therapies that will benefit you guys and help you get your results that you guys are looking for as well. So IGF-1 LR3, great therapy, been around for a minute, and it's always done well with Titan patients. I've used it, very good stuff. And we have all different levels of dosing and prescribing for people and different goals and whatever we're trying to accomplish. We can help you guys out there. How you guys doing? Thank you guys for tuning in. I appreciate it. Thank you guys. Titan Talk Tuesday is going full effect. We talked about EDCs, importance of blood work, and we just went over IGF-1 LR3. So, where does it go in the body? So we talked about in the body too. So when you take IGF-1, and let's talk about growth hormone. So if you take growth hormone, and your growth hormone is made in your pituitary, right? And then it goes down from there into the liver and produces the IGF-1. Now, some people are stuck on HGH because they hear it over the counter. They heard it so many times. Real HGH, if it's prescribed from a pharmacy, is very expensive. It's highly regulated by the DEA. They don't want it used for anything except for what it's supposed to be used for by the FDA, according to them. And that's dwarfism, adult growth hormone deficiencies, things like that. There's only a limited amount of things. Where this IGF-1 can be used for some other different things that aren't as far as that goes, but not regulated as hard too as well. And when you take growth hormone, you will have to take it for an extended period of time. And when you do take it, it could possibly shut down the natural effect or stimulation in your pituitary. And that means you might be dependent on growth hormone. And this is very expensive. Something happens, you can't take it, you might go deficient at that point, it might crash the levels. But what happens is at that point, it goes down to the liver like we talked about and converts into IGF-1. So essentially, instead of taking growth hormone and then have to go from the pituitary down to the liver, you guys are going from the start to the finish right away with injecting IGF-1 straight off. You guys are getting the benefits right away. It's going in the system right away as IGF-1, which is a benefit to you guys, plus cost factor, okay? And maybe not shutting down the pituitary as well. So you got some benefits of taking big benefits of not taking real growth hormone to taking IGF-1, okay? And those are the benefits. States opening back up. I don't know what states you guys are in. I'm in Florida. Florida is starting to come, I guess, out of it this week, hopefully. I just, like I said, got word the pools are opening Thursday at 50% occupancy. The beaches are supposed to open up May 4th. And hopefully other businesses are going to start opening up too as well. I've seen I think there's 8 other states that are going right along with us. As far as that goes, Texas, South Carolina, Georgia's already there. You guys have been hearing about Georgia. Everybody's been hearing about Georgia. But some of the other states are doing the exact same thing as Georgia, and they're just not getting put in the frying pan. I'm trying to think. Wyoming might be one of them. There's other ones: Alaska, Colorado, Idaho, Iowa, Minnesota, Mississippi, Missouri, Montana, Nebraska, North Dakota, Ohio. Ohio's May 12th.
Yeah. Okay.
All right. So this isn't the full list here. They're almost there. I know Colorado's April 26th. Yeah. So Georgia's one of them. Idaho's on May 1st.
Find a better list.
Yeah. So listen. If you guys know what you guys are doing in your state, so hopefully you guys are getting out of it soon. We're going to get back to normal soon, hopefully. And what's a new normalcy going to be? But, hopefully these states will get back. We'll have some sort of guidelines of what's going to go on. I'm really anxious to see what's going to go on in just restaurants and movie theaters and gyms. I've heard a lot of rumors. I would think until I hear it publicly, I'm going to take it as a rumor. But some gyms are like 10 people and, first come, first serve. All right, so 8 states: Arkansas, Iowa, Nebraska, North Dakota, Oklahoma, South Dakota, Utah, Wyoming, and Florida. We know Florida is because I heard DeSantis today, who is our governor, with the president this morning. What's going on, guys?
Everybody's making moves.
Everybody's making moves, so hopefully everybody will be open soon. And like I said, we'll get back to a new normalcy. Well, that'll be good. So hopefully your state isn't locked down anymore, or we'll be gone here in about a week or two, and we'll all get back to it. And we can get back to hopefully the gym life or some sort of normal life where things are going like in a routine, because I love routine, right? Do you guys do testosterone as well as other compounds, or just test along with vitamins? We do everything. So, as well as other compounds. Yeah, we do testosterone for sure. We do testosterone replacement therapy, like hormone replacement therapy, males and females, vitamin amino acid injectable therapies, blends, special blends that we have, like Hercules Potion, Titan Complete, Titan Ultra, all those different ones. IVs, so if you guys are seeing me right now, we do IVs in-house. If you guys are in-house, we do primary care service, we do rejuvenation detox, we do bedroom enhancing therapies, so you guys get that right. You want to make sure that your partner knows that you're a superhero in the bedroom and make them feel good. And we also do, a lot of different other things, like we've got facial creams, we've got skin tightening creams, our fat burning cream, which is awesome. A lot of girls like that. So a lot of different therapies we can offer to you guys out there. A lot of peptides too. So peptide, AOD964, healing peptides, BPC157, TB500, MK677, which is an oral GHRH. It also stimulates IGF-1 levels. So we'll talk about MK another time. We also have CJC1295 with Imperellin. That's another one, a GHRH injectable, and that also helps with IGF-1 levels, helps sleep patterns, helps heal faster, helps you get lean mass. There's a whole bunch of different options for you guys, and it really comes down to what are your goals, what's your family history, what's your health history, what's going to be best for you. And that's where Titan Medical Center can help you guys out. That's where the consultation goes over with the medical provider. You're going to see the medical provider. You're going to go over everything with the medical provider. If you have blood work, then go over with that with you too as well. And that's what I like to hear. People bringing the peptides out to play. Yeah, so all the things that we do too are medically prescribed, right? They're medically prescribed. They come from U.S. licensed pharmacies. There's no research chemicals or sites or anything that's not for human consumption. These things are all from the pharmacy, prescribed in your name, right? So at that point, they're your prescription and they are for human consumption, so you guys can utilize them. All right, and they do have great things. What's up, Amanda? How you doing? Dr. Janitorial, how you doing? Christy Ward. So if you live out of state, we can service you, not a problem, in whatever services we offer, except for IVs. Somebody asked me the other day, hey, can you guys send me an IV bag? No, okay, all right, because we don't know who's going to hook you up and all that good stuff. So if you're here, you guys get an IV. Everything else we offer out of state. So wherever you're at in the country of the United States, the good, God, brave, courageous country of the United States, we can service you guys. Whatever you guys need, immune system boosters, we got your back there too. So thymosin alpha-1 is a great peptide, right? Vitamin C injectable therapy, zinc therapy injectable, glutathione, nectar of the God, which is an awesome blend. We have that too as well. So all these other ones, we've got it, right? Definitely got to try us out for sure. Let us know. Tyler, thank you. Great company. Used our BPC. It helped out a lot. So I love to hear.
Facebook comments up here.
Woo! Christine Leonard, I love IGF-1 therapy. We love it too, and we love you too, Christine. All right. Hi. Shout out to you, Big Drew, and your whole crew from Jim Rhoda. What up, JD? How you doing, man? Hey, Drew was telling me about you the other day. We were laughing out loud. We watched one of your videos with one of your sons with the cornhole thing. That was hilarious. What about Complete Vitamin you were working on? So the Complete Vitamin we were working on. So we have Titan Complete, right? I also have one that was worked on that, I haven't injected it yet, but it is out, where it has vitamin C, glutathione, and zinc in it, all in one blend. It's like a super immunity booster we've been working on. So it is out, if that's the one you're talking about. If not, Titan Complete is out, and it's been out. That's one of our biggest sellers. Way to keep it real. Thank you, JD. I love it. Life over money all day long, guys. How do you guys know what MCGs to prescribe? So if it's on IGF-1, now it just depends how the therapy is broken out. It really depends on what the patient is trying to achieve. So at that point, if it's weight loss, and that's what a good thing, or healing, there's a couple different ones, and there's a couple of different micrograms that are prescribed to the patient from the medical providers. And that's what the medical provider is going to go over with you. I couldn't tell you I can tell you some basic protocols of what's prescribed, but for a patient, it's really personalized. And when they get in that consultation, that's what they're paying for. The medical provider go over this information with them and to personalize the regimen for them. If it was cookie cutter, and I see cookie cutter all the time, guys, it's embarrassing to me and what our profession is as a medical service or providers and a company in general to have cookie cutters prescribed for these kind of treatments. The reason is it might work for the masses, but there's going to be some people out there it doesn't work good for. And that's the real reason, because you don't want those people to fall through the cracks, feel bad, something goes wrong, they're on the wrong doses, and it's not a good look. So at that point, it's not prescribed in the cookie cutter type fashion out there, okay? Is the IGF-1 an injection? So Mona, yes, IGF-1 LR3 is an injection, okay? They haven't made oral IGF. The only thing that's closest to that's oral is MK677, IGF-1, and that increases IGF-1 levels. It's not oral IGF, but it is the closest thing to it, okay? All right, so I've been spot injecting Hercules Potion in a few different spots of the muscle to be trained, and it's unbelievable. I hit 4 spots in each bicep, and the same in each tricep on the pump was amazing. City Tropic Standing, listen, you and me and a whole bunch of other people around the United States, we love Hercules. I love hearing the feedback from, especially, you're kind of new with us, I would say, right, for a while. But I've had people on it 4, 5, 6 years. I've been on it 7 or 8 myself, and it just never goes away. It's always the best, especially before training, man. Especially if you're using it. Now, I don't like to inject my legs, so I won't inject my legs on the days I do legs. But everywhere else, pecs, biceps, triceps, shoulders. I don't do calves. I don't do quads, and I don't do anything else. So at that point, upper body wise, pecs, biceps, triceps, I'll hit there. And anything else, I'll just hit systematically, delt-wise. And it goes through the body. That's the best thing about it. You get more instant gratification when you inject in those muscles that you're training that day, right? But you'll get a great gratification if you just inject it, let's say in your delt, and you worked out legs that day. You're still going to get a massive pump, the vasodilation, right? Be able to work out longer, all the great benefits of Hercules Potion. It's just you get more instant gratification when you do inject those parts. It is what it is. So it's a great therapy, and thank you for bringing that to our attention. Thank you for the feedback. I love it, guys. I love it. I'm happy that you're keeping patients first. There's always patients first, guys. Since we started, that's all it was. It was, we didn't have a lot of money for advertising. It wasn't like that. We started by patient, and our patients were going to be our advertising. The results speak the highest, right? So when your patients are happy, they're going to talk about it to everybody. And that was it. Get with one patient, get them results, move on to the next one, and so on and so on and so on. And that's where we really snowball today, and we've had thousands of patients around the country, and we're blessed for that. And thank God when this hit, we were logistically set up to service our patients in all these ways. Another big one that I'm going to announce tomorrow, but I might as well tell you guys now, we officially have antibody testing from major labs. So LabCorp, Quest, all the major labs, we have antibody testing. We can send our patients in anywhere in the country. So if you guys want antibody testing, you want to know if you have the immunities testing, right? They now offer it, and we offer it to our patients. So it's huge. These aren't the South Korea or China tests that came over that, there was a percentage that weren't right or wrong. We don't know. Not cheap tests. Those tests coming across, were cheap, man. So at that point, I didn't want to get anything like that. But when LabCorp and Quest roll something out, these are solid labs. These are the main labs in the country. So at that point, like you guys have heard, LabCorp is going to start doing at-home tests. They're going to be able to send out too, which is going to be very exciting. For these, we're going to send you into a patient service center. That means a lab in your area. We're going to be able to hook you guys up with that, give you guys a slip. We're going to screen you guys beforehand. It's real simple and real easy to do. And you guys will know, am I negative for the immunity? Am I positive for the immunity? Do I have the antibodies or not? Now, I told people the other day, because we've had these tests already ran on people now. So I've seen multiple people come back. I even had my dad tested, who has, he's very, very high risk. He's had congestive heart failure. He's in stage 4 kidney disease, right? He has diabetes type 2, right? He's older. He's over 65 years old. So I'm real scared about him. Now, in December, he had surgery. He had to get, he had pneumonia, which was a big thing that went along with this coronavirus, which I was real scared of. And we didn't know about coronavirus at this time. He had water in his lungs. Okay, and then he had to go in there, and he had some other things as far as, the kidney and everything like that. So they had to get this tube and go through him and basically suck out this water and get it off his chest, and he had some by his heart too. So he had it all done. But we thought, like about a week or two ago, I'm like, man, he must have had coronavirus, right? Because he had all the symptoms. He had pneumonia afterwards too. They couldn't diagnose it was coronavirus or regular flu at that time. So we really don't know. So I thought he did. So we ran the antibody test on him yesterday. Got it back within 24 hours. Usually it takes 48, so I was real surprised. Came back negative. Now it's a good thing because it came back negative. He's never had it. The bad thing is now I'm really scared. I don't really want him to go around anybody. So it's a double-edged sword. But let's say you did come back positive for the antibodies. That means, hey, listen, now you can go around people. So it's really good in both lights. It's just, I guess with the antibodies, I think you might feel you're more protected in a light. So really cool. So we can definitely do that. Yes, our Tampa location is open. We have not closed. We are essential. We do primary care as well for patients around the United States. Cholesterol medication, blood pressure medication, all these different things. STD medication. We did herpes medication for a lot of patients that need it, okay? A lot of offices closed during this. They weren't set up logistically to handle patients like this, which we were. Thank goodness, thank God. We have tons of medical practitioners and doctors ready to go too as well, so we can handle the influx of patients that we needed. So it was a big, big thing for us. Ice on the cake, massage. What do we got here? Reply to Ricky Jerkowski. Yes, he lived.
Are you live now?
Yes, I am live right now. Have someone with me that has an immune system that is so compromising. So yeah, I mean it's a huge thing, Ricky. At that point, I've seen massage, myofascial release on top, but I've had a long-lasting nagging tendon ligament injuries in elbows and knees. So seeing a BPC 157 was the way to go, since nothing else has helped. Definitely BPC 157, that TB 500 are really, really good ones. In healing wise and stuff like that. Definitely the nagging tendon and ligament for sure. Those will definitely be good. Elbows, knees, joint areas, those two together for sure too as well. I work in the ER somewhere in Tampa. There was a day at my hospital back in January. We saw about 350 people. So that's when I really seen it. That's really was crazy. How do you or what do you recommend for someone who cannot go anywhere? So our pharmacies ship directly to their doorstep, so they don't have to leave their doorstep. So they are immunocompromised, or they're scared to go outside, or they're in the high risk category. The medications or these immune system boosting things can come right to their doorstep. Okay, it's real simple, real easy. Milano Muscle. How much does what cost? The antibody test. If you guys are looking for the antibody screening, yep, that's what it was. With the test through the major labs, it's $150, and that covers the screening. It covers your testing. You don't have to pay any more money. That's what it is. We'll give you the result, and at that point, help you guys out. So that's anywhere in the country. You guys can sign up, and you guys can get the blood test. So MS, yeah, that's a big one. Now we have athletes that have MS too, for sure. Craig Brodsky, he's one of them, a good athlete, stuff like that. There are some different therapies. Like I said, the immune system boosting ones are going to be great for them if they're immunocompromised. MS, Hercules potions are a really good one too, to really help with motor skills and stuff like that too as well. It's definitely helped them. They definitely want to stay active. They want to make sure their muscles are staying strong and staying tight because that's kind of what MS does. It's really a horrible, debilitating disease once it gets to a certain point. But the whole point is try not to get it there, or do whatever you can to be preventative. to do your best to not get there, okay? If you're interested in IGF-1, think it's great that Titan Medical Center is bringing the best therapies to the fitness community. Thank you, Michael Neal. So, yeah, so IGF-1, so not just the fitness community, we're here for everybody. You know, and we do have a lot of athletes and stuff like that, but 80% of our patients are regular people. They are not athletes. They have no want to be an athlete. They don't want to look big and strong like Hercules, but they want to feel good. They want to look good, and they want to perform better, right? They want mind and mental cognitive enhancement if possible. They want to do their best. They want their partner to feel good or themselves to feel good in the bedroom, outside the bedroom. Both ways are good, I guess. So that's really what we're here for, okay? All right, so being humble. All right, so this is a big one with me, guys. I've always been humbled. You know, I've been here. I know how it is on both sides of the coin. And I really respect people, and I respect the things that people work for. I'm humble. I don't care. You know, I really literally dress with like Nike pants and like a shirt every day. I'm not like crazy out like that, but I am humble about it. You know, anything I get, I know it can be taken away in a second like that. I know the bottom can drop out in a second, and I'm always prepared for that. So at that point, I'm always humbled. And I try to teach my son to be like that and everybody like that. It's good to be confident, but it's another thing to be cocky. Or to take it and be, you know, just, I've seen people just super not humble, right? And then at that point, really respect and respecting things. So if you see somebody outside and they have, I don't know, a Bugatti outside, and you think this person, you know, screw them, they got a Bugatti or whatever it is. You have no idea what they worked through or what they put on the line to get that, right? So at that point, like for somebody up there to disrespect the car or anything like that would be wrong, and that's not being humble. Or, you know, like, I hate to say this, so if I have somebody out there, and I have somebody clean my car every week, right, and them just not respect it, like, it's just because it's not theirs. It is what it is. I've seen people like this, and I just can't wrap my head around it, but I guess it's how people are. There's no respect these days, and respect is earned, right? But respect should be given, too, in some way, shape, or form, if it's in a different situation. So be humbled, respect people out there, but if they don't respect you, it's a whole different story. Then don't respect them back, and you guys got to handle that business. How long have you been in Tampa? Your passion, your business is such a good energy. So we've been in Tampa, Titan Medical Center, since November of 2012. So that's 8 years. And upcoming, hopefully 9 here very shortly. It keeps going and going and going. Our new location is right down here in Channelside, 912 Channelside. We've got a whole brand new multi-million-dollar state-of-the-art facility down here for you guys. So whenever you guys do come down, if you guys get IVs, you won't be staying like me. You guys will be sitting in nice, comfortable chairs, watching whatever you guys want on Netflix. We've got it all lines for everybody's pretty much lined up like that and good to go. Oh, what is going on here? Got to get my IV going some more here, guys. Got a little bit left here, so I'm trying to get it going. All right, so that's really about it. The Titan Corona Package Stimulus. So for that Titan Corona Stimulus Package, it's on social media right now. So whether you're on Facebook or you're on Instagram, go to the Titan Medical Facebook or Instagram. The last post that's on there before this one, for Titan Live, you guys can get on that. Follow the directions of what you guys want. You guys will get a free Ultimate Health Bible if you guys win this one, and a Titan Fitness Program 12-week package, full diets or nutrition, customized for you guys, broken out, plus a 12-week exercise program. So you guys are going to get all this information, and it has an app that goes on your phone. So if you're mobile, you guys can take this to where we're at. The gyms are going to be coming back soon. If not, there's home exercise workouts on there. You guys can take advantage of as well. There's going to be a third stimulus package, right? I'm like the government. I'm having 2, 3. I might even have 4 or 5. But 3 is going to be the free immune system boosting therapy package with the free consult, totally free. That's like a $500 package right there. Next week, that one starts. But take advantage of this one. Who says you might be able to win both? You never know. Ultimate Health Bible, Titan Fitness Programs. Go to the posts on Instagram or Facebook. Get entered. Unlimited entries. Follow directions. Get entered. The more times you entered, the more times you have to win. So that's going to be a really big giveaway this week and next week. We gave away last week. I gave away 3 winners last week. I was only going to do 1. I did 3. I went above and beyond like Titan Medical Center always does, all right? What makes you all different from B12 stores? Oh, this is good. I like this one. Thank you. I like this one. Real River, I'm about to break it down for you. What makes Titan Medical Center better than a B12 store? Now, here in Florida, they kind of beat me to the opportunity. It was a good idea. But they've got these places in the malls, and they're getting their butts handed to them right now. But because they're all closed. But at this point, they have B12 stores. So this is a store you could go into, right? And they have a medical assistant there, and they'll give you a free, or not a free one, excuse me. They'll give you a B12 shot. And then they have a MIC B12 shot. And they have a vitamin D shot. These are 3 shots that they give there. Now, a B12 shot there, Rio, so you know, and I'm pretty sure you do, that the B12 shot there is $20 a shot. $20 a shot, right? That's not bad. You're like, $20 I spend, you really don't know. So you're like, all right. So the MIC, methylene acetylcholine with B12, right? This is supposed to help supercharge metabolism a little bit. What it does is it actually helps you process fats faster in the liver to help boost the metabolism. That's how it works. But that's included in there. That one's $25 to $30 a shot, a single shot. Now, if you were to get a B12, if you were to get regular B12 from us, it's going to be $180 for 30 shots. That breaks down to $6 a shot. Plus, you can self-administer. That means that you can do this in your office or home or wherever you're at and the convenience by yourself. You don't have to go into the store and get a single shot, right? And if you try to buy the shots from there, you're going to charge you $20 per shot. 30 shots in one of those vials equals $600 is what you would pay. And you pay $180 for us. But let's take it away from the price point, because we kill the price point, what you're going to get, so you're getting a lot more bang for the buck. Number 2 is this. We've got these different blends that have B12 in them, that have B-complex, mix in them, branched chain amino acids, L-carnitine, all in one shot. That means you get 8, 9 different ingredients in one shot. Instead of B12, you're going to get B12, B-complex, MIC, branched chain amino acids, L-carnitine, so you're going to get a lot more bang for the buck. And it's in the same dosage you would get the regular B12 for. Makes no sense, right? So that's what makes Titan Med, and that's just our vitamin and amino acid injectable therapies. I mean, there's a lot more that I could say, but that's all they offer there. So, that's really minute in what we're talking about. And now you can see the difference between a B12 store, injection, and a Titan Medical Center blend, or you could get it straight. So you can get a lot cheaper straight, or you can get a blend, and you're going to get a lot cheaper, and you're going to get a lot more bang for the buck as far as ingredient-wise, which is going to give you better results. You're going to get more things out of it. It only makes sense, man. It only makes sense. So I hope you love it. Yes, sir, $20. So, real, $20 a shot. People tell me, man, $180 for 30 shots, or $275 or Hercules Potion, which has 9 different ingredients in it, or Titan Complete for $275. I'm like, dude, it's only like $9 or $10 a shot at that point. You can't even go into a doctor's office and get an injection that cheap. If you came into a doctor's office, and let's say, because we're all out of pocket, right? So you guys are cash pay. Don't worry about it. I got insurance. I got the best insurance, John. I promise you. So you're going to go into a primary care, if you can find one open right now. And then at that point, you're going to pay your copayment. What's your copayment cost you guys? Now, I can't tell you that information because I ain't paying your copayment. But I'll tell you what the normal copayment is. It's $25. It's $25. So you go into primary care, right? You sit there for, who knows, half an hour, 30 minutes, 40 minutes. It might be quicker right now. You pay the $25. So you're paying $25 for the shot. You go back, you sit in there, you waste more time, you get the injection finally, and you finally come out. Now, the insurance company, they might not cover that injection. You know what? Because you might not have been deficient for B12. The practitioner might not give you a B12 shot because they want on blood that you're not deficient for B12. So at that point, you might not even get the injection and pay the $25 anyway. This has happened to people. These are prime examples of what could happen to you guys. So that's really where it's at. Now, B12 store, you can walk right in there. I want a B12 shot. They're going to hook you up, $20. But like I said, why do that? You're wasting time. First of all, you can't even go into a mall right now. So all the malls are closed. So you ain't going to a B12 store. And that's what I'm saying. The best possible thing at that point, have the medication at your house, be able to give yourself the injections. Now, I can't give myself an injection with a little insulin needle. I don't know how. I don't know what to do. I'm in the area of Tampa. Come into the office. We'll happily do it for you guys. And we're doing B12 shots here in our office for $10. $20 for 2 shots. So if people wanted vitamin C and B12, or they wanted zinc and B12, or they wanted whatever we have to offer, they're going to get those shots very, very inexpensive, and they're going to get some awesome boosts and stuff out of it.
I think Ricky's had some shots.
Love the shots with you guys. Yeah, so Ricky, I know Ricky way before Titan. So Ricky knows me and Cherise before Titan Medical started. So yes, the shots are awesome. Tighten up. She understands. Boosting wellness, the wellness, the best. Where I need to go or call to get back started with Titan.
Well.
Call or text 727-389-3220. We'd be happy to help all you guys out. And that's what it is. Since 8% of your patients are non-athletes, what supplements are most popular for them? So really, it's the exact same. I'll be honest with you, Dr. Janitorial. So as far as the injectable amino acids and vitamin-wise, Hercules Potion, Titan Complete. Those are definitely 2 of our top therapies, okay? They get great results. They get instant gratification for patients. They notice things right away. Those are great ones, right? And they work for the average person who's not an athlete. Everyday life, those are great ones, okay? Other ones, ECA Stack Plus. A lot of people like energy. They want fat burning. They want weight loss. They want mental concentration, better concentration. And that's where really the ECA Stack Plus comes into line. It's probably one of the best out there. It's oral. It's a little form of a capsule. So it's very simple to take. It can replace a lot of the negative things out there you might be putting in your body to get those effects, aka energy drinks, right? Over-the-counter stimulants. You have no idea what's in some of those proprietary blends. Okay, so it's getting ready. Maybe coffee from staining your teeth. Some people like to drink coffee. That's great. Black coffee, I used to like to drink black coffee. I didn't really want to stain my teeth anymore. That's why I stopped. But I like the taste of it. So some people like the taste of it. That's fine. But if you want to get away from it, this is definitely something that can help. If you think you're drinking too much coffee, this is something that can help out with that too as well. So this is another one that regular people do. Does IGF-1, do they go over your insurance? Yeah. Dude, IGF-1 by insurance companies? I've never seen one written out unless they were truly like, if your IGF-1 level came back so deficient, like a multiple tests, and then, you know, at that point, you know, you had basis for it. If you had to do over and over testing and you were that low in your IGF-1 levels, they might do it, but I've never seen it done before. Let's put it like that. And growth hormone, barely ever. You know, I mean, usually doctors, even with testosterone levels, let's say your testosterone is on the lower end. So from 18, right, to 39 years old, or I guess from 49 years old, 216 to 946. That's the normal lab court reference range, okay, for a male total testosterone. So if an 18-year-old comes back at 217, they are clinically normal, but they're on the bottom end of the barrel, man. If a 49-year-old, 59-year-old comes back at a 217, like you're still in the bottom of the barrel. You're going to feel like that number, but it's different for an 18-year-old to be there and a 59-year-old or a 49-year-old to be there. At that point, it's a lot of years in between, and like I said, they should be at their very, very best. So, you know, that's really where does clinical deficiency come into play? And, you know, at that point, if they are clinically deficient for many, many tests and the provider thinks that might be a good treatment, the insurance company might do it. But the insurance companies still go against testosterone replacement on insurance. Like, you have to go jump through a lot of hoops. And even they put caps on dosages, which they shouldn't, in my opinion, but they do. That should be up to the doctor or the pharmacist at that point that really makes those recommendations. All right, so that's really what it is, guys. All right, so we got a poll question. Woo!
We also have a live poll going on.
We have a live poll going on.
I went ahead and opened it up for the people that
Thank
are on Facebook.
you. All right.
Very cool. So you want to read that one?
Yeah, let's do a live poll. What have you tried for losing weight, keeping muscle, right?
Or getting more energy.
Or getting more energy. 13% of you said nothing.
The minimum.
6% of you said energy drinks. We talked about those energy drinks. 19% said over-the-counter supplements. What are those supplements? I want to know. Tell me. And you know that everything has to be passed through the liver, right? And then what's the absorption rate of that, getting better, broken down the gastro tract? Let's talk about that maybe next week. Working out, 65% of you.
Yep.
Good job, guys.
And
That's huge.
Newsletter's about the same, too.
Newsletter, so what have you tried for losing weight, keeping lean mass, or getting more energy? 4 was nothing. 10 was working out on that one. So that was the big one. So working out is definitely take cake. Good. Hats off to you guys. Kudos. That's my crew out there. Keep that mentality up and keep working, guys. The other one after that, energy drinks. Over-the-counter supplement was another big one. Let's talk about those. Because what are you taking for over-the-counter? Are you taking over-the-counter fat burners? Those aren't really good, guys. I'll tell you, I've had a lot of people go to the hospital, have a lot of negative side effects from those things. So if you guys are feeling jittery, bounce off walls, makes your stomach upset, that shouldn't be going on. That should not be going on. And 4 of you, nothing, you guys need to get on it. You guys need a little kick in the butt. Let's go. Come on. It's time to get on it. I put a post out today. It's time to put the pedal to the metal. Push the pedal to the metal. And that means, hey, listen, we're going to get over this. It looks like we're coming out of it now. Come on, man. Let's get going, guys. Let's not get stuck in this holding pattern. Let's keep moving ahead, right? Moving forward. So that's it. What was the health Bible you talked about? So that's on the coronavirus stimulus package, the Titan one that's been given away. The Ultimate Health Bible, your guide to disease prevention, weight loss, and other things. So this is a book written by me and Jeff Bahar. It's on Amazon, it's on Barnes & Nobles, it's on every major site where you can buy a book from. We've had this book out for about a year now. I helped out a lot of people, got a lot of great feedback. I got a lot of people from the fitness industry gave me great feedback on the book. Great book. So that would be one that you guys can win on the Corona Titan Stimulus Package, or you can go pick up your copy now and get ahead of the pack. Get that reading on right now. You guys got some time. Now's the time. Check it out. Do you have materials I could get to send to someone who I think would benefit from Titan? So what materials? Let me know, Ricky. Text us. Let me know. You can always pass them on the website. They can call our text here. That's really what it is. Because you can fill out the new patient paperwork right on the website. You can literally go on the website on your phone, your tablet, your computer, and literally fill out the new patient paperwork and send it in right from there. So you don't have to scan it. You don't have to email it. You don't have to do anything else, okay? I need results worked out since the military over-the-counter ain't helping. We'll be there soon. Real River, we got you, man. And make sure that you mention that you are active duty or you're in the military or first responder. If you guys are out there, guys, we will take care of you guys. We're offering you guys discounts. We want to make sure we got to help out everybody we can in this possible problem situation that we got going on. We're hopefully going to get over it soon, fast. We're almost out of it. Let's go. All right? So we're done with Titan Talk Tuesdays. Thank you guys for tuning in. It's been another great show, great activity. Thanks for the live poll art. Appreciate all you guys commenting on it. Thank you guys out there. I'm going to finish up this IV, and then I'm heading home to hang out, relax a little bit, watch The Last Dance. Michael Jordan. We'll talk about that Friday on Titan Lifestyle with Big Drew. Also, the Titan Medical Health and Lifestyle Show every Sunday, ABC, 11 a.m. We got all great new content for you guys coming. All the great things Titan Medical Center does, plus Cupid's Corner with me and Sharice, telling you guys about that great relationship advice. So I appreciate you guys all tuning in. See you guys next Tuesday for Titan Talk Tuesday. Remember, Titan Lifestyle with Big Drew, Friday 2 p.m. We're announcing the winner of the Titan Corona Stimulus Package giveaway. The Ultimate Health Bible with the Titan programs, 12-week fitness, nutrition, and training for you guys. Thank you guys. I appreciate it. We'll see you then.
Is your summer body ready? We have the answer.